Recovery after surgery, the important thing initially is to reduce swelling and inflammation and pain with rest and elevation and ice. Ice over the front of the hip is very important, particularly for the anterior approach. Elevating the leg on 2, 3, even 4 pillows so it's above the heart, above the chest is really helpful. Lying with the back down low on a bed or couch is good. Resting periodically throughout the day as your swelling and pain dictate is critical the first week or two. As swelling and pain decrease, I encourage you to get up and walk. I want you to put as much weight as your pain dictates on the leg. If you're very painful, rely on the crutches or walker initially. If you're not, put weight on the leg. It's okay to do that. Be gentle. Don't go doing any high impact things initially. Walk gently. Walk as much as your pain dictates, and rest and elevate then again as much as your pain and swelling dictate. Exercises after surgery, the two that I've found to be most successful are stationary bike and pool therapy. Pool therapy is the best. Once your incision is healed and sealed, it's good to get in the water. You don't need to do laps. I encourage you to walk in the shallow end, walk backwards and forwards in the water, sidestep backwards and forwards. You can hold on to the side of the pool if you like, or have floaty boards or even a life jacket on if you feel like it. It's not important to be in the deep end. You don't need to do laps. It's walking and using the resistance of the water to move the leg through that's quite therapeutic. And once your pain settles then, a water aerobics class is also a low impact water aerobics class is another great way to increase your motion and strength that you've lost with the arthritis that you had prior to surgery and then with the surgery. Stationary bike, fairly self-explanatory, but important thing is make sure your seat's at the right height. You don't want to be down too low and have your knees coming up too high. You want to mainly use the opposite leg for propulsion and just follow along with your surgical leg. As time goes on, you can use your surgical leg to move the pedals, but it's low resistance, very low resistance, gentle movement, keeping the resistance down below 3 or 4, and not going for too long initially, 10-15 minutes. Increasing things incrementally as your pain and swelling dictate. If you go too long, too much resistance too soon, you'll be sore and you'll set yourself back a few days. So really take things in slow increments. Gentle stretching is okay. You don't want to be working on extremes of motion the first month or two. Your soft tissues need to heal and your risk of dislocation is higher the first few weeks. As things settle down and you get off your narcotics, then you can start doing more as your pain dictates. Once you're feeling good and things have settled and you feel you've maximized on the pool and stationary bike, you can do more of the aerobic exercises in the gym, like elliptical, step machine, treadmill, doing walking and then light jogging. Low impact, low repetition, low impact, low resistance, more higher repetition and more time is the way to progress rather than high resistance. First 2-3 months, these implants are becoming fixed by your bone, and that bond continues to mature up to a year after surgery, and more for some. So it's important early on not to overstress these implants to enable their bony bond to become strong enough. As this bond strengthens, then the implant can resist more strain. Complications with surgery, infection and blood clots are the two biggest things I worry about. It's critical to really keep your incision clean and dry during the early phase until it's watertight, and controlling swelling with ice and elevation. Blood clot risk is significant, particularly with swelling and inactivity and just the trauma from surgery. So minimizing swelling and inflammation is critical to reduce that risk, and then moving as your pain dictates to start getting blood circulating more normally. Dislocation is a risk. It's less of a risk with the front approaches up to the hip, I believe, and so I don't restrict your activities to reduce this risk, but I really ask you to be sensible. Don't overbend the hip. Don't move it in extremes of motion, particularly while on narcotics. You won't have the feedback that will tell you when you've reached the limits of your motion. There are risks of anesthesia. Spinal anesthetic is what I feel to be the least risky anesthetic, and I encourage it for everybody. You can be as sedated as you want during the surgery and fully asleep, but spinal carries with it less risk and highly recommended over a general anesthetic. But any of these forms of anesthesia have risk associated with them, and particularly with pre-existing problems, heart problems, lung issues, diabetes, we worry about the increased risk of anesthesia and then the surgical risks that I just discussed, infection of blood clots particularly. Activity after surgery, you can do what you like after surgery. The longevity of these implants is governed highly by the type of activities you're doing and how high impact they are. So running is a very high impact type activity versus swimming or biking would be lower impact. So the more you can do of the lower impact activities, the longer your implants will last. But you can do any activity. It's important to realize that while you're on narcotics or recovering soon after surgery, you won't have the feedback of pain that you need to govern your activities. And it's also important to realize that even though you may not have pain, you may still have important healing of these implants going on, particularly the first 2-3 months. And so limiting the high impact activities early on is quite important to give these implants time to heal.